defective na siya kay di siya maka-melt og tarong. Yan. So that's your paraffin wax bath. Discuss lang tabalik later. And then you have also this is your hot HMP or hot moist pack. Yan. And then lastly, you have your ultrasound. So for this, specifically for lab during pracs, what will be included is kanarang na-discuss sa kaning mga videos. For example, infrared, sa pa to, mga fluidotherapy, etc. Wala man siya dire, no? So most likely, or dili gid siya ma-appeal later on during the pracs nga exam sa lab. But later, sa atong exam later, included to tanan discussed during the lecture. So for my topic, sa thermotherapy, specific lang to hot moist pack and paraffin wax bath ang included for thermotherapy. And then ask na lang mo ni Sir Darrell kung unsay included sa iyang topics nga cryotherapy and ultrasound. So most likely ultrasound will also be included. But for cryo, I don't know if unsa or i-include tanan ba or not. So just clarify it with him. But again, for my topic, only these two, paraffin, hot moist packs, and your paraffin wax bath. So let's start with your hot moist pack. This is your... All right. So this is your hot moist pack. Kita ba na? Kita ra na?
Yes, sir. Makita ra.
Alright. So this is your hot moist pack. You have your hydrocollator tank or kaning machine responsible for heating the hot moist pack, which is this one, kaning canvas. And then you have your... Sorry, medyo blurred ah. Ako lang, pwede mong balik-balik. I won't play the video lang, but ako lang i-discuss. So you have your hot moist pack, kanang this one, the canvas. Kaning gi-point na ko on my left hand. And then you have your hot pack cover, kaning blue, and then your towel. So during the discussion, pag lecture, around pila to ka layers needed, it's usually around 6 to 8 layers, right? 6 to 8 layers of dry towel. Okay, 6 to 8 layers of dry towel. And your hot moist pack, this one, kaning blue, pwede siya it's equivalent siya to 2 to 3 layers of your towel. So but for most centers sa ako na encounter, wala kay sila kaning hot pack cover, kaning blue or Turkish towel, siguro other name but general name niya is hot pack cover, kaning blue. It is shaped siya based on the size pod nga imong gamiton nga sa hot moist pack. So for example, sa cervical katong triangular in shape or mas bigger area katong bigger rectangular, so it would depend. And then there are several sizes pod of your hot pack cover nga mo match with those sizes ng hot moist pack. So again, 2 to 3 layers of towel ang corresponding aning hot pack cover. Again, wala kay ani sa clinics, mostly good towels lang good. So if towels, again, it is around 6 to 8 layers. 6 to 8, that would mean other side is 3 and then the other side is 3. So composed na siya of 6. So included na tanan, including the front and back side na layer. Diba? Kung mo siya i-wrap na may layers sa other side and layers sa other side. So that includes the 8 layers. Kaya if you imagine one side is 6, another side is 6 or 8, baga na kay tanan and maglisod na naglapos ang heat from the hot moist pack. So again, that included ang both sides. So if ever kaning Turkish towel or hot pack cover, this would respond to 2 to 3 layers from one side ra. So meaning whether siya 2 to 3 layers of one side or either 4 to 6 if ever may total. So you can use good one hot pack cover plus one towel that would correspond na to 6 to 8 layers of your 6 to 8 layers of towel. Yeah. So again, and then pick mo na yung materials aside from the bell nga you need to inform the patient if ever he or she needs immediate assistance. So for your hot moist pack or your hydrocollator tank, again kanang tank, it is approximately 70 to 75 degrees Celsius. 70 to 75 degrees Celsius. Again, Celsius ang atong reference lang dili nito mag Fahrenheit. 70 to 75 degrees Celsius. And usually it would take 2 hours to heat. So early sa day during your duty hours sa clinics, first thing you need to do is turn on your modalities. The paraffin wax bath and also your hydrocollator tank. They need time for heating man. They need time para mo init ang modality. And usually it takes 2 hours to heat to efficiently heat the modality. And if ever niyo reuse ang hot packs, at least ma-reheat siya for 30 minutes before using it. So mo vary good ang layers of towel kay aside from the patient's preference and kanang tolerance to heat, if ever daghan mo magamit sa hot moist pack, dili siya efficiently ma-reheat if ever daghan mo magamit. So instead of reheating it for the recommended 30 minutes, sometimes 20 minutes, 15 minutes, gamito na siya balik, especially if ever daghan mo og patient. So if ever yung ana, mas lesser good og towel inyong magamit for the patient. Sometimes good sa theory sa books or sa proper application of modalities, sometimes dili gid siya mo match during when you do it sa clinic. Okay, there are several factors nga maka-affect ana. But for theory, you need to know the basics or what is in the theory. But sometimes again in the clinics, you really need to adjust or to modify, and sometimes dili na siya mo match sa kung sino sa book. But dili na siya sayop as long as you can provide the unsay purpose ana nga example for the modality. All right? So sometimes lang yun na ng instances. So these are your materials. Use your cervical side. Alright. Cervical, of course, ito i-play ng part. Hot packs, first you have to determine what size or what kind of hot packs you are using. So for this procedure, I used the cervical size hot packs. This is for the cervical. We'll be using cervical. Of course, we also use the cervical size Turkish towel. As mentioned kanina, each size imong hot packs na ay corresponding size po sa hot pack na cover. So, i-get lang using a tong and then ipa-drip ang water and then place it here sa hot pack cover and then wrap it with a towel and then apply it to the patient. Yeah. So that's for your hot pack. So proper procedure niya, before anything else, before applying anything to your patient, always inform the patient on the thing that you are going to do. For example, applying this modality, inform the patient kung unsa siya, what is this, what is it about, ang purpose, and everything before you go to the procedure. So during the procedure, always remove the clothing and jewelry within the area to be treated. For some, okay ra if na ay sanina or di niya hubuon ng sanina or na clothing that is fine lang. Ang jewelry lang ang i-remove if ever na kay some jewelries are conductors of heat man, so muinit siya and possible makapaso. Yan. After that, after preparing the patient, take off na all jewelries. And then, as mentioned kanina, wrap the hot packs into 6 to 8 layers of dry towel. Again, it would vary. After wrapping it, apply it to the area to be treated. And then for instructions, if ever inyo biyaan ng patient, kay example, daghan mo patient, and then you need to attend to another patient, you can do so. However, always instruct the patient to, example, naibel or unsay sabot ninyo to anytime if ever kailangan siya assistance or na siya concerns, maka-call siya immediately. So, muna yung purpose sa bell if ever naibel. And then every 5 minutes, you need to check the area being treated to check for adverse effect, either redness, burns, or nanabay blister. But for OTs, usually one-on-one man ta, no? Usually PTs ra kung makita nga mo treat og daghan nga patient at the same time. So for OTs, maximize your time. If ever mag-apply mo modality, you can continue your interview, ask information about the patient or educate the patient about his or her condition and unsay possible new recommendations or anything that would help the client or the patient regarding his condition. Rather than inyo lang pasagdahan ng patient and then maghuwat ra mo sa time mahurot. So maximize your time. Modalities is usually applied for 15 to 20 minutes, but murag ang general nga time ihatag is 15 minutes. Kaya medyo taas-taas na 20 minutes and then wala kayo may madu if ever, especially if dagag modalities ang patient. Okay, usahay dili ra hotbox, dili ra ultrasound. Usually sabay ang na siya ultrasound then napo siya paraffin wax bath. If ever daghan kay modalities and then mag 15 minutes each, 20 minutes taas kay ma-cover, no? And then preparatory ra na ma-consume yung time for occupation based. So make use of your time if ever na pamoy madu while giving these modalities. Yeah. So access lang the videos here for hot moist pack. Na duha here application here sa cervical and then the low back pain. So those are access lang this. So those are your procedures and materials being used in hot moist pack. All right. So again, always inform the patient regarding anything ay mong buhaton. What is it, purpose, and then inform also them if ever imo na i-apply on that specific area. Yeah. Next is your paraffin wax bath. And for paraffin wax bath, guys, these are your available physical agent modality. And so this is your paraffin wax bath. For your paraffin wax bath, as mentioned, you should turn this on first thing in the morning. Kay it also needs around 2 hours, siguro 1 hour above. If ever in ani kabaga, like daghagsod and then ni gahitanan wax, that would take around 2 hours para mo melt. For this case, gahi pa ni siya kay medyo defective na ni nga paraffin wax bath na machine. So wala gid siya naka-melt. So that's why video na lang akong gibutang. Defective na ni siya nga machine. Yeah. So again, around 2 hours na siya ma-melt ang whole thing. So you need to turn that on first thing in the morning. So that's your paraffin wax bath, and it temperature must be around 45 to 50 degrees Celsius. If ever inyo na is set, you can set it man. And so for your paraffin wax bath, you only need this, the wax, the machine, and then you also need a wax paper and a towel. Yeah. So for the application, we have one video here, paraffin wax bath, ang deep wrap method. Taas man siya. Deep wrap method. Anyway, sige. For paraffin wax bath in general, first procedure you need to do, aside from informing the patient what is the procedure you're going to do, what is it about or the purpose, etc. After that, you need to remove again all jewelries and have the patient wash the area to be treated. This is to prevent contamination lang if ever na ay bacteria present sa extremity. So possible if dili ninyo i-wash and then mo-apply mo diri sa og wax. And as I've mentioned, most of the clinics kailangan na i-reuse ang wax. If ever hugaw and then imo siya ibalik sa katong machine, ma-contaminated na nun siya and possible ma-transfer sa next na patient ang bacteria. Alright, so you need to clean or wash the patient's extremity and dry it off ang area nga giwash. Aside from that, inspect if there are any open wounds or contraindications for paraffin wax bath. So for those na skin present skin allergies or conditions, you may still use paraffin wax bath. However, do not reuse the wax. And if ever mag-use mo, use a separate container for this one. If ever contaminated or na skin condition ang patient and you'll apply it directly sa machine, ma-contaminated noon. So again, procedures, first two procedures aside from the instruction is remove all jewelries, inspect the area, and then wash and dry the area. And then you can now proceed with either of the three methods for paraffin wax bath. So for paraffin wax bath, first method is your deep immersion kaning sa video being presented. So hopefully na-access ninyo last time no kay na-aram na siya the whole thing. Sige, ato lang i-play. So as you can see sa video, always have the patient's hand or fingers spread out. So for paraffin wax bath, this is your deep wrap method, fingers apart and then dip the patient's hand sa container. As much as possible, as far as possible, including the wrist. Include the wrist nga part. So dip it once, and then dip it once, and then remove it from the container. Let it rest for a few seconds para mo dry o mo harden ang paraffin. And then redip it again, fingers apart gihapon. And then you repeat this for 6 to 10 times to have it several layers ang imuhang extremity. Again, it is 6 to 10 times, but again, during practice, sometimes if ever dili kaya sa patient, you can do lower. But try to have it around 6 times. Yan. After that, after dipping, as you can see here sa video, you can use a wax paper or a gloves to wrap the patient's hand. After that, wrap it with a towel. And then let it stay there for around 15 to 20 minutes or usually 15 minutes. Some would elevate the extremity if ever included sa inyong goal is for circulation, but some pwede rin yung i-rest sa table. And then that's it for your deep wrap method. Deep for 6 to 10 times and then wrap it up with a wax paper and a towel. So example lang na maghuwat ra mo you can do another activity. So example, mag-ROM exercises mo sa other side or any activities or interview. So again, maximize your time. That's for your deep wrap method. So after 15 minutes, you remove and then clean the patient's hand. And then next method is deep immersion. For deep immersion, you can use directly here sa paraffin wax bath na machine, or you can get a separate container and then dito mo mag deep immersion. Same thing with deep wrap. Init magod kay niyang machine. So for some patient dili sila ka-tolerate og init kayo, that's why pwede mo magkuha og separate container and transfer the paraffin wax there, and dito mo mag deep wrap or deep immersion para at least mo somehow subside ang kainit sa paraffin and mas matolerate na sa patient. Again, before anything else, i-test good ang hotness sa modality. So you can use the intact extremity to test if ever init ba kaayo or kaya na sa patient before doing the procedure. So for deep immersion still method or procedure, remove jewelries, inspect the extremity, and then wash the area to be treated and then dry it up before you do deep immersion. So for deep immersion, same thing kanina, fingers apart, dip it for once lang. After that, erase to have a layer, one layer sa imuhang extremity before doing the deep immersion. So i-dip og once, i-remove to have the paraffin wax harden or mo-opaque na siya, and then dip it for pila ka minutes, and that will be your deep immersion. And so if ever you will be using the machine, again, as mentioned kanina, it is 45 to 50 degrees. If ever you will use the machine, which is pwede naman. However, if ever daghan mo magamit, dili makagamit ang uban if ever directly mo gamit sa machine. But you can use the machine directly. So if ever you'll use the machine directly, make sure to use the lower end of the temperature, which is 45 degrees. So if ever karon and then nag-expect mo nga namoy patient later on, the next hour for deep immersion, make sure to set it at 45 degrees Celsius daan. And then when you perform na the deep immersion, make sure to turn off the machine. So use or perform deep immersion while turn off ang machine. So i-turn off daan before you do the procedure. Alright, here no need to wrap kay gi-immerse naman siya for pila ka minutes. Then after approximately 15 minutes, remove it and then i-clean lang siya ang hand. So that's your deep immersion. And lastly is your paint method. For paint method, these are for patients nga low tolerance kayo og heat, like initan gid sila if ever i-immerse or i-dip ang inyong hand. So you can do paint method. So for paint method, recommended nga one stroke lang, either proximal to distal or distal to proximal. And then make sure to paint it, the whole hand, including the wrist, for around 6 to 10 times. Same sa katong deep immersion, deep wrap. Paint it 6 to 10 times para to correspond to a 6 to 10 layers po daw katong paraffin wax. But again, it would depend yun sa clinic. If ever too long kayo mo mag-paint method, open ba ang area, ang uban aircon pa, so dali kayo mo bugnaw ang paraffin wax nga imong gi-paint sa example sa hand. So mawagtang na ang purpose kay nibugnaw na ang paraffin wax. And this is a thermal agent, hot thermotherapy, so you need to you need to control gyud nga ma-retain ang heat sa modality. So maglangay-langay mo paint, mubugnaw na diha ang paraffin wax. So mawagtang ang purpose sa inyong modality. Yan. So again, after painting, wrap it with a paper or wax paper and then cover it with a towel. Leave it there for around 15 minutes. For the minutes, makabantay mo na 10 to 15, na 15 or na 20. But sa exam, wala kayo na ko i-consider ang time man siguro. Kaya again, mo vary magit siya sa per clinic or per center. But ang average gyud or the general time nga gialat, it's usually 15 minutes. Yan. So that is your paraffin wax bath nga paint method. So questions, clarifications for these modalities. Questions, clarifications. So for lab, sa akong part, again, it's only paraffin wax bath and hot moist pack. Ask naman ni Sir Dalaril regarding his part. Sige, questions, clarifications. Please access lang yung videos para maka-review mo. During pracs, kay i-demo siya ninyo in terms of giving instructions or kanag yung how you do it. Like, sir, okay sir, mag-start na sir, mo din yung paraffin wax bath. Ako ni siya, blah, 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 blah. Okay sir, ito sa suwayan sa imo ang good side there, if ever okay na bang kainit and anything. So, inform, instruct the patient always before you do it. Okay, questions, clarifications before we'll have our exam. If none, daghan kayo.